Perfect. So this is going to be, there's so much more to say about this topic, but I wanted to give you guys just uh, I'll just say an appetizer, and I'll make more corny metaphors as we go through the talk, but an appetizer of the gut-brain connection in mood disorders in psychiatry. And I just want to say that I got interested in this work about, I would say, the connection between inflammation and mood disorders is something that I got really interested in about 2 years after I graduated from residency, when I had a pretty serious existential crisis in my career, where I was using the medications and the psychotherapies that I had learned about in residency. And I got pretty discouraged a couple years into my practice when I realized that those two things alone weren't going to cut it for way too many people. And I actually quit psychiatry, and I went on a kind of a walkabout looking for other ways to understand what happened and how to help people get well. And I had a huge beneficial moment that happened to me. I feel so blessed that a former patient of mine who I had treated with an SSRI and a benzo for his anxiety, had generalized anxiety, very severe. We did CBT for a year, and we did one of the SSRIs and a PRN benzo. He really didn't get much better, and he was highly motivated. He did everything I asked him to do until I quit my practice and left town, and he went and got tested for gluten sensitivity, had a positive celiac test. He stopped eating wheat and watched his anxiety melt away, and then he tapered off his medications and still had no anxiety. I check in with him from time to time, and he is still free of any anxiety whatsoever. So that was in 2004, and it was a massive shift in my thinking about what's really going on with people who are quote unquote treatment resistant. So from there, I started investigating and reading and going to CMEs and learning about gut-brain connection and inflammation pathways. And I'm going to share with you some of the things that I've learned and the ways that we work with it in our clinic. So this is a telling place to start. All disease begins in the gut, not just things that we would associate with the gut, but also there often in our practice in integrative psychiatry here in Boulder, we find massive connections between what's happening in the gut and what's happening with psychiatric symptoms. So trying to keep this brief as we move through this, 5 gut-related contributors to treatment-resistant depression. This is kind of more of a CME format. I don't think this is a CME talk, but I like to stay in my formats. Summarize the connection between gut inflammation and mental health symptoms, and explain why checking a high sensitivity C-reactive protein makes sense in psychiatry. So if you're in the field, these statistics are probably not new to you. I recently updated this slide from 300 million people worldwide to 320. It's, you know, and the reason I say that is because the escalation over the past few years has been really logarithmic. It's very scary what's actually happening with mood disorders, with 1/3 of the people treated for depression not making it in terms of achieving a treatment response. And of course, Big Pharma has all but abandoned any effort outside of this new movement in psychedelics for depression to really try to bring more tools to the table. And our approved treatments for treatment-resistant depression, TMS and ECT, have significant downsides. The STAR-D study really painted a pretty bleak picture for people on the merry-go-round of trying new, more and more trials of antidepressants with less and less efficacy over time for people. So here's how I think about contributors to treatment-resistant depression, and I just highlighted the ones on the right side of my screen as more of what we're going to talk about today. But it's worth bearing in mind that we are living in a really tough time right now. Structural and cultural inequities, structural racism, pandemic angst, existential despair. There's quite a lot of Reasons why people are more depressed right now: isolation, being on Zoom all day, not getting to have the oxytocin exchange that we have in live sessions with patients, for example, and a lot of loss, a lot of relationship conflicts. Domestic abuse rates are way up in COVID. So just to put things in context of what I think we need to be paying attention to as we try to help people through a really challenging time here. And I wanted to put this slide up. This is a map that we use at the Institute in kind of training people to look at the big picture of what the issues are that we need to help people with. And if you take a quick look over this, you can see that there are causes of treatment-resistant depression everywhere in here. I'll start at the top, just relationship conflicts and isolation, attachment styles, insomnia, obstructive sleep apnea, of course, and, substance addiction, technology, screens, disordered eating. I mean, all of these things can be contributors to persistent inadequate response to our efforts to help people get well. And so I tend to think about these as a kind of a snowball effect. If we can try to attend to the biggest levers of action, then we usually can get people under a threshold where they may not have symptoms anymore. They may still have issues, but they may become unsymptomatic if we can drain out some of these root causes. So a very high correlation between major depressive disorder and inflammatory disorders, up to 30% of a comorbidity there, and 2 to 3 times greater than the general population. And it's important to note also that depressed patients have higher serum levels of inflammatory cytokines, and that these pro-inflammatory cytokines actually decrease during during remission from depression. And that's also true for bipolar disorder, that we see elevated IL-6 and C-reactive protein in manic episodes as well as depressive episodes. And for that matter, we also see similar issues with chronic PTSD, that persistent elevations in pro-inflammatory cytokines that do resolve with adequate treatment. And so this is the work of Chuck Raison, who is probably the greatest pioneer in connecting inflammation to mood disorders and psychiatry. So his map here shows increasing levels of inflammation with increasing levels of chronic depression. I'm not going to spend too much on this slide, but essentially the model of giving people interferon alpha and causing this acute immune stimulus is a sort of a chemical model for inducing depression chemically by installing pro-inflammatory cytokines. But we see this also in our folks who struggle for decades with depression. Here's a huge 4,500 individual study out of England. This is a prospective study that basically shows, the font is a little small here, so I'll read it, that the likelihood of having a depressive episode or a psychotic experience has a kind of linear increase relative to your level of IL-6 in childhood at age 9. So what they did is they drew these cytokine levels in children, and then they followed them along into adulthood and saw who got depression and who had psychotic episodes. And there was a significant relationship here, a correlation. Also, being inflamed as a mother, having a high C-reactive protein, increases the risk of autism by 80% in infants. And this is from the Finnish Birth Registry, which is a registry of 1.2 million people. So this is a big amount of people. Correlation, but it's interesting. And when you start thinking about all the things that can cause inflammation, or that can cause inflammation levels to persist over time, we have a long list of those things. And here's another study of serum IL-6 and CRP and this is in study of adults. This is another British study of civil servants with an N of over 3,000 people, where the finding was that baseline CRP and IL-6 predicted cognitive symptoms of depression. So the basic idea here is that having persistent elevated levels of inflammation is destructive, not just to the body, but also to, I would say, to the mind, to how we think, to how we experience reality, and certainly to brain functioning. I wanted to throw this in here. This just came out. This has not been peer reviewed. This is preprint, so just take that with a grain of salt. But gut microbiota diversity and C-reactive protein are predictors of disease severity in COVID-19 patients. Again, not that surprising that we would see people with impaired microbiota diversity and higher levels of gut inflammation not doing well with COVID-19. But it's something that's good to know as we try to prepare our patients to be not just symptom-free, but more resilient going into the future. So here's my kind of short list, my cheat sheet when I think about the reasons why someone might have elevated gut inflammation. And you can see that the standard American diet appears in position 1 and position 2 and the last position on the list. The reason for that is we in mental health care, I think even those of us who are focused on integrative mental health care oftentimes don't pay enough attention to what people are eating. And a lot of these things on this list are related to the standard American diet: dysbiosis, candida overgrowth related to too much sugar. We have sugar and alcohol over here. If we could just stick with the basics, which is what I love about Julia Ruckledge's book with Bonnie Kaplan that I'm going to mention later. Stick with the basics. Let's get the diet right. And we can clean up so many things if we could just get that right. I know it's not a very sexy thing to do, to talk about with patients, rather than presenting the next newest, greatest thing, but it's fundamental in helping people get to wellness and stay there. Nutritional psychiatry is something I think all of us should be practicing. Dietary interventions significantly reduce depressive symptoms. Reducing junk food and replacing that with high fiber, nutrient dense alternatives works. So again, more grist for the mill. And as far as the standard American diet goes, one of the issues is that you're going to be eating a lot of glyphosate, which is also known as Roundup, if you're not familiar with that. And Roundup has not just a negative impact on the soil, but it also has a very significant negative impact on the gut microbiota and causes us to, it's associated with increased levels of gut inflammation and leaky gut. There is some thought that the combination of gluten with glyphosate, and the reason that combination is worth mentioning is that gluten on wheat berries, genetically modified wheat berries, which is what American wheat is for the most part, 30-fold increased level of gluten makes the wheat berries really sticky. And glyphosate is doused onto wheat berries in American wheat to dry out the wheat berries so the combines don't get sticky and don't malfunction. So eating American wheat by definition means you're eating a lot of Roundup. And so the combination of Roundup plus gluten seems to be involved in the disruption of the tight junctions. And disruption of tight junctions at the gut level is very much associated with disruption of the tight junctions in the blood-brain barrier. So what are the clinical signs? Any GI complaint. Now, if you're a person like me, I personally have a strong gluten sensitivity, but I have zero GI complaints. And so when my naturopathic doctor, who I saw for years, kept trying to get through to me to eat a gluten-free diet, I wouldn't do it. I didn't do it for 5 years and he kept working on me. He was very patient because I had no complaints. So not having a GI complaint doesn't mean that you don't have issues with your diet. I just want to put that out there. The CNS symptoms I like to look for are the sort of broad-based across the board neurotransmitter deficiency symptoms. So problems with energy, problems with focus, problems with anxiety, problems with insomnia, problems with motivation. I think about all of the neurotransmitters being involved in a presentation like that, and that has me thinking that there's probably a root issue at the gut level that's causing these problems. So that's something to think about. Overconsumption of sugar and sodas is huge. A family history of autoimmune disease, because Hashimoto's, MS, these kind of autoimmune presentations are highly associated with gluten sensitivity and celiac disease. So looking for those in the history can be helpful. And then strategies, and again, the basics here. Bonnie Kaplan and Julie Rucklich's book is great, The Better Brain, highly recommended. If you don't know about those guys, their research has been really wonderful contributions into multi-ingredient formulas, particularly Empower Plus, and looking at the impact of nutritional psychiatry on common mental health disorders. So I would highly recommend getting a hold of that. And then taking actions that minimize baseline levels of inflammation. So feeding your brain with increased microbial diversity, better immunoregulation that comes from bigger diversity in your microbiota, and increasing stress resilience. So these are the things that can really pull the lever and increase our ability to tolerate stress and decrease our baseline background inflammation levels. Dr. Chris Lowry is one of our heroes here at the University of Colorado, who's done a tremendous amount of research on the impact of biodiversity of the microbiota in the gut. He's looking at not just the impact of diversity, but also the potential therapeutic benefits of individual bacterial strains. Very interesting research. And his own personal practice, which I always like to know what the experts do in their personal practices, is to make a probiotic shake every morning with 25 different species of organic vegetables. And the tip here, I've been doing this now for a couple of years, it's pretty great, is that you only need a pinch of each one of the vegetables. And when I go and do this at the Vitamin Cottage here in Boulder, it costs me about $15 or $20 to do this, to get a month or a month and a half of the probiotic shake. So it's it's really closer to about 50 cents a day is what I estimate, based on what our, it's actually not that expensive to do, in other words. And Chris says that each species of plants has its own microbiota on the skin of the plant. So what you want to do is rinse the plants lightly with water, and not scrub them down with soap, and throw them in a blender with equal parts of water as vegetable matter, and put a scoop in a tall glass of water every morning. And my wife and I like to make a couple of jars of this, and then we take the extra material and we put it in ice cube trays and we leave it in the freezer. And after our fresh stuff in the one jar runs out, we use the ice cube trays for the remainder of it. And then, of course, going to a Mediterranean diet, or at least a low sugar diet, can have a huge impact on mood disorders and depression. Prebiotic foods are also important for developing the matrix for the healthy microbiome to live inside of in the gut. And so I like to recommend broccoli, avocado, and beans for that. So the take home here, to quote Michael Pollan, don't eat anything your great grandmother wouldn't recognize as food. I love that. And eat food, real food, not too much, and mostly plants, and shop around the edges of the supermarket where there's actual food that came recently from a place where it was growing in the ground or on a tree. So I'm going to leave it at that and take a few questions, and want to thank you guys again for inviting me here to be here.